Hi Andy, this is Dr. Joshna MR. I'm the medical coding trainer from Indian Healthcare BPO. మెడికల్ కోడింగ్ ట్రైనింగ్ కోసం మా ఇండియన్ హెల్త్ కేర్ బీపీఓని కాంటాక్ట్ అవ్వండి. స్క్రీన్ పైన కాంటాక్ట్ నెంబర్ ఇస్తున్నాం చూడండి. వాట్సాప్ నెంబర్ 7200035525. మరిన్ని మెడికల్ కోడింగ్ వీడియోస్ కోసం మా ఛానల్ని లైక్ చేయండి, షేర్ చేయండి మరియు సబ్స్క్రైబ్ చేయండి. మెడికల్ కోడింగ్ ట్రైనింగ్ తీసుకొని మంచి మెడికల్ కోడింగ్ కంపెనీస్లో ఎపిసోడ్స్, ఒమేగా హెల్త్ కేర్, ఏజిఎస్ హెల్త్, వి టెక్నాలజీస్ లాంటి మంచి మెడికల్ కోడింగ్ కంపెనీస్లో మెడికల్ కోడర్గా మీ లైఫ్ని స్టార్ట్ చేయండి. సిపిసి సర్టిఫికేషన్ కోసం మా ఇండియన్ హెల్త్ కేర్ బీపీఓని కాంటాక్ట్ అవ్వండి. సిపిసి సర్టిఫికేషన్ ఉంటే వర్క్ ఫ్రమ్ హోమ్ ఆప్షన్స్ కూడా ఉంటాయండి విత్ అష్యూర్డ్ ప్లేస్మెంట్స్. ఇప్పుడు మనం టాపిక్లోకి వెళ్ళిపోతున్నామండి. ఈరోజు మనం డిస్కస్ చేసుకోబోయే టాపిక్ అండ్ ఇంట్రడక్షన్ టు బాడీ స్ట్రక్చర్స్ అండ్ మెడికల్ టర్మినాలజీస్. ఫస్ట్ మెడికల్ కోడింగ్లో ఏ టాపిక్, ఏ సిస్టమ్ గురించి తెలుసుకోవాలన్నా మనకి ఫస్ట్ మన అనటామికల్, ఆ సిస్టమ్ యొక్క అనటామికల్ పొజిషను, మెడికల్ టర్మినాలజీస్ ప్రతి ఒక్కటి తెలిసిండాలండి. ఎందుకంటే ఆ సిస్టమ్ యొక్క పొజిషను, ఆ మెడికల్ టర్మినాలజీస్ తెలుసుకుంటే ప్రతి సిస్టమ్ మనకి ఈజీగా అండర్స్టాండ్ అయిపోతుందండి. కాబట్టి ఇది ఒక బేసిక్ చాప్టర్ అండి. ఫస్ట్ ఈ చాప్టర్ నేర్చుకొని మళ్ళీ మిగిలిన సిస్టమ్స్కి పోతే మీకు కొంచెం టర్మినాలజీ అవేర్గా ఉంటుంది. ఓకేనా అండి? ఇప్పుడు మనం టాపిక్లోకి వెళ్ళిపోదామా? ఫస్ట్ బేసిక్ డెఫినిషన్ తెలుసుకుందామండి. అనాటమీ. అనాటమీ ఈజ్ ద స్టడీ ఆఫ్ స్ట్రక్చర్ అండ్ ఫార్మ్ ఆఫ్ ఆర్గానిజమ్స్. అనాటమీ అనేది ఒక స్టడీ ఆఫ్ స్ట్రక్చర్ అండ్ ఫార్మ్ ఆఫ్ ఆర్గానిజమ్స్ అండి. అండ్ సైంటిస్ట్ హూ స్పెషలైజ్డ్ ఇన్ anatomy are called anatomists. Okay, let's come to anatomical position and directional terms. Anatomical position refers to a person standing erect with eyes looking forward. Person standing erect. Person erect ga stand ayi undali. Eyes looking forward. Eyes forward ga looking undali. Directional terms. In directional terms, note that the body is at anatomical position. See here in figure. Directional terms, note the body is in anatomical position. Now coming to table, directional terms used with the body. Directional term, meaning and example. You have to memorize this table. Okay. See, directional term, right. Toward the right side of the body. For example, the incision was made right of the midline. Incision means one incision is made at right of the midline. Left, toward the left side of the body. Abbreviations to the lumbar region where observe 1 centimeter left to the midline. Now, anterior. Anterior means ventral side. Posterior means dorsal side. See here at the picture, you can see very clearly what is ventral side and what is dorsal side. See the picture. Second picture. Anterior means toward the front surface of the body. Example, the toes are anterior to the heel of the foot. Posterior means dorsal. Toward the back surface of the body. The upper portion of the thoracic spine is posterior to the sternum. These examples is for our convenience only, for our facility they are given, but you have to memorize the what is directional term and what is meaning. Now, medial, toward the midline or center of the body. The inner ear is medial to the outer ear. Now, lateral, farther from the center of the body pertaining to a side of the body. The hip is lateral to the groin. Groin means private parts. Superior, toward the head or upper portion of the body. The eyes are superior to mouth. Inferior, toward the foot or lower portion of the body. The shoulders are inferior to the head. Proximal, toward or closer to the attachment of an extremity to the body. The knee is proximal to the ankle. Distal, away from or farther from the attachment of an extremity to the body. The wrist is distal to the elbow. Superficial, toward the surface of the body. The scalp is superficial to brain. Deep, away from the surface of the body. Deep means internal. Muzzle is deep to skin. Prone, lying face upward or having the palm of the hand facing inferiorly or posteriorly. Lying face is downward or having the palm of the hand is facing inferiorly. supine and prone positions are very important. Supine means lying face upward. Prone means lying face downward. Ulnar and radial. Ulnar means pertaining to medial side of the structures in upper limb. Radial pertaining to lateral side of structures in upper limb. Ulnar means pertaining to medial surface of structures in upper limb. Radial means pertaining to the lateral side of structures in upper limb. Ulnar means medial side, radial means lateral side. Understand? Now moving to planes of the body. Anatomical plane of the body is an imaginary flat surface that passes through the body at different places in order to divide it for anatomical purposes. Okay, see here the picture, you can clearly understand planes of the body. Normally planes of the body are, see here, planes sagittal, mid-sagittal and transverse. The description for this is sagittal means divides the body into right and left sides. Mid-sagittal means divide the body into equal right and left halves. Transverse means divides the body into upper means superior portion and lower means inferior portion. See this in figure. What is superior aspect? What is inferior aspect? Frontal or coronal planes, right side sagittal planes, in the medial mid-sagittal plane. Transverse means horizontally transverse plane and posterior means dorsal aspect. Anterior means ventral aspect. See here in the picture, you can clearly analyze what are the planes of the body. Now coming to movement terms. The joints of the body have a wide range of normal movements. Normally our joints, మన joints movements చేస్తాయి కదండి, చాలా movements చేస్తాయి. A variety of terms such as rotation, extension and flexion are used to describe these movements. Rotation, extension, flexion ఈ movements ని describe చేస్తాయండి. Physicians and other healthcare workers use these terms when describing normal or abnormal movements of joints. మన movements normal గా ఉన్నా అబ్నార్మల్ గా ఉన్నా ఫిజిషియన్స్ ఇలా రిప్రజెంట్ చేస్తారండి. ఓకేనా? మూమెంట్ టర్మ్స్ చూడండి, ఈ టేబుల్ చూడండి క్లియర్ గా. మూమెంట్ టర్మ్ వాటి మీనింగ్: అడక్షన్, మూమెంట్ ఆఫ్ ఎ బాడీ టువర్డ్స్ ద బాడీ ఆర్ టువర్డ్స్ ద మీడియల్ ప్లేన్. మూమెంట్ ఆఫ్ ద బాడీ టువర్డ్స్ ద మీడియల్ ప్లేన్ కి వస్తే అడక్షన్. అబ్డక్షన్, మూమెంట్ ఆఫ్ ద బాడీ పార్ట్ అవే ఫ్రమ్ బాడీ ఆర్ అవే ఫ్రమ్ మీడియల్ లైన్. ఓకే, abduction, adduction, you know the difference. Towards and away is the only variation between abduction and adduction. Now inversion, turning inward toward the midline. Eversion means turning outside from the midline. Now flexion, movement that decreases the angle between two adjoining bones, such as bending elbow. Here when we bend the elbow, the angle between the elbow decreases. Angle between the two bones decreases. Movement that decreases the angle between two adjoining bones, దాన్ని flexion అంటాం. Extension, movement that increases the angle between two adjoining bones, such as straightening a bent elbow. If you bend the elbow, it is flexion. If you straighten that bent elbow, it is called extension. Clearly understand? What is dorsiflexion? Bending a foot towards upward. When we bend the foot towards the upward, you see, it is dorsiflexion. Plantar flexion means opposite, bending of foot towards downward. Also represent pointing the foot. The foot is pointing downwards. Radial deviation, bending of a joint of the wrist or hand away from the midline. Ulnar deviation means bending of a joint of the wrist or hand towards the midline. Right and left lateral bending means movement that increases the angle of the upper portion of the body away from the midline, either to right or left. Internal rotation means rotation of the joint inward or towards the midline of the body. External means outward. Right left rotation means rotation of a joint to right or left. Here also supination came. Supination of the forearm means forearm towards a position in which palm is facing upward. Palm is facing upward means supination of forearm. Supination of foot means movement of foot is raised upward to medial edge. Pronation of forearm, rotation of forearm towards the position in which palm is facing downward. If forearm of foot is facing upwards, it is supination. If rotation of forearm or foot is towards, is raised downward, it is called pronation. Did you understand the difference between pronation and supination? Clear? Now coming to body cavities and the spine. Let's we discuss about major body cavities. The body has many cavities such as nasal cavity, cranial cavity and thoracic means chest cavity. Some of these cavities open outside the body and others do not. ఈ ఒక్కొక్క క్యావిటీ అనేది outside of the body లో ఓపెన్ అవుతుంది, కానీ కొన్ని ఇంటీరియర్ గా కూడా ఉంటాయి. In this section we will discuss about 4 major body cavities. 2 dorsal. Dorsal means last side we discussed, no, posterior. Ventral means anterior side. The dorsal cavities are cranial cavity and spinal cavity. The ventral cavities are thoracic cavity and abdominal pelvic cavity. See this table 5.3. Body cavities. In this figure you can clearly analyze what are body cavities. Cranial means, see the major organs. I am giving the major organs. Cranial means brain. Spinal means spinal cord. Thoracic means lungs, trachea, esophagus, heart. Abdominopelvic means stomach, intestines, liver, spleen, pancreas, kidneys, reproductive organs. The cavity and which organs come under this cavity I had clearly mentioned. Once you go through the organs come under the following cavities. Let us discuss about quadrants of abdomen. The quadrants of abdomen are right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. Here short forms also given. Right upper quadrant means RUQ, left upper quadrant means LUQ, right lower quadrant means RLQ, left lower quadrant means LLQ. These are the short forms. See this figure, you can clearly analyze where are the quadrants. Let us discuss about spine. Spine is also referred to as vertebral column or backbone. The spine is composed of bones called vertebrae and has 5 regional divisions. See here the vertebrae: cervical vertebrae, thoracic or dorsal vertebrae, lumbar, sacral, coccyx or tailbone. Cervical vertebrae extends from C1 to C7. Thoracic T1 through T12 or D1 to D12. Lumbar L1 through L5. Sacral S1 through S5. Coccyx CX. They are total 33 bones. Okay. Now let's discuss about abdominopelvic cavity. Abdominopelvic region is the largest body cavity and contains most organs, some of which are quite large. The abdominopelvic cavity is divided into 4 sections. In the last slide we discussed quadrants of abdomen: right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. Let us discuss about the regions of abdominopelvic cavity. They are right hypochondric, epigastric, left hypochondric, right lumbar, umbilical, left lumbar, right inguinal, hypogastric, left inguinal. Okay. Let's discuss about combining forms. Why these combining forms are useful? Why we have to study? Let's discuss. Combining form of a word consists of a word root and combining vowel. With these combining forms, the terminology comes from. See word root, combining forms, meaning, examples. Once see this table, combining forms. With this, we have to combine the word root and combining forms. Arthur. See, it is pronounced as O. Arthro, joint. Examples: arthritis, arthrogram, hemarthrosis. Adi, audit, audio, audito, hearing, audiology. Bronch, bronchi, broncho, bronchio. Carcin, carcino, cardi, cardio. Derm, dermat, dermato. Dermato means skin. Enter, entro, intestines. Gaster, gastro, stomach. Him, hemat, hemo, hemato, blood. Hepat, hepato, liver. See, with this word root, pronouns with combining forms, and here the meaning is there, and with examples. Once see this table, you can clearly analyze what are combining forms. Once go through this. Now let's discuss about color related combining forms. Means combining forms which are color related. See, in previous slide I told word root, combine with combining form, meaning and examples. Here, alb, it is a word root. Combining form with o, elbow, meaning white. Example, alba, albin, albino, it is also white, albinism. Anthrac, anthraco, black. Anthracosilicosis, anthracosis. Chlor, chloro, means green, chlorophyll. Chrome, chromo, color, chromosomes. Chromat, chromato, means color, chromatography. Cir, cirro, tan yellow, cirrhosis. San, cyano, means blue, cyanosis. Eosin, eosino, red, eosinophilia, eosinophilia. Erythrem, erythremo, means redness or flushed, erythrema. Erythromat, erythromato, redness, erythematosus. Erythro, erythro, red, erythroblast or erythrocyte. Gluck, glauco, means grey, glaucoma, glaucoma means optic nerve damage. Jand, jando, means yellow, jaundice. Look, leuco, white. Leucine, leuco, white, leukemia. Lute, luto, yellow. Melanin, melano, means black, melanin, melanoma. Pheo, dark, pheomelanin. Polio, grey. Polioencephalitis, poliomyelitis. Xantho, means yellow, xanthogranuloma. See, color related combining forms. Once look after this table, let us discuss about prefixes. What is meant by prefix? Prefix is a word element that is attached at the beginning of the word. If any root word is there and word element is attached at the beginning, it is called prefix. See here this table. Prefixes are given. Here miscellaneous prefixes. Prefixes of position or direction. See here. Ant, against, anti, against, auto, self. Brachy, short, brady, slow. Co, together with. Con, together with. Contra, against, opposite. Counter, opposing. This, bad. Echo, sound. U means good. X, former. Hetero, different. Homo, same. Here middle, these are all pronunciation. This is the prefix and this is the meaning. Pachy means thick. Pseudo means false. Quasi means to some degree. Re means again. Self means oneself. Sim means together. Sin means together. Chacky means rapid. Tele means distance. A, no. An, not. D, lack of. Im, not. In, not. Nully, none. Un, not. Prefixes of position or direction. See, ab means away from. Ad means toward. Af means toward. Ana, backward. Anti, before. Keta, down. Circum, circular movement. D, down. Dia, through. Ek, out. Ecto, out. F, out. M, in. N, in. End, in. Endo, in. Epi, above. X, out. Exo, out. Extra, outside. In, into. Infra, under. Inter means between. Intra means within. Midi, middle. Means also middle. Meta, between. Over means above. Para means near. Per, through. Peri, around. Post, before. Pro, before. Retro, backward. Here examples also given. Once go through this prefix, how it is pronounced and the meaning. Once look at this table, you can clearly have an idea. Read along with examples also once. Okay. Continuation from the last. Sub means under, super means above, supra means above, trans means through, ultra means beyond, under means below. See here prefixes with quantity. Quantity means the number, how many are there. B means 2, bis means 2, centi means 100, deci means 10th, D means 2, diplo double, hemi half, hyper excessive, above than normal. Hyper means excessive, hypo means deficient, kilo means 1000, macro means large, micro means small, milli thousand, mono one, multi many, pan all, poly many, quadru 4, semi half, tetra 4, uni 1. Understand prefixes of quantity? Let us discuss about suffixes. In previous slide we had discussed about prefix. Now we are going to discuss about suffix. What is suffix? Suffix is a word element that is attached at the end of the word to create a new word. Prefix means word element that is attached at the beginning of a root word. Suffix means word element is attached at the end of the root word. Here see table general suffixes, suffix, pronounced, parts of speech, meaning, examples. Parts of speech is for reference only, not needed now, not needed, just for knowledge purpose. See the pronunciation, suffix and the meaning. I will tell one or two. Able, capable of, ism, medical condition or disease, logi, study of particular subject, pose, having the characteristics. See the table. Once read and go through the table with example, you will have a general idea. In previous slide, they are general suffixes, but this table is medical and scientific suffixes, which are coming in our medical terminology. These suffixes are very important. Read with suffix, how the pronunciation will come, meaning and example also. Algia means pain, neuralgia, blast, immature cell, erythroblast. Cell, noun, celli, swelling, hernia, cystocele. Clasia, break, fracture. Diaclasia, classis, means break. Anaclasis, clast, break. Osteoclast, site, means cell, lymphocyte. Disease, bending. Arthrodesis, dyna, pain. Mastodyna, ectomy, removal of anatomical part, means removal of an anatomical part. Appendectomy. Emia, blood condition. Leukemia, form, in the shape of, vermiform. Gen, producing, carcinogen. Genesis, coming into being, pathogenesis. Genic, produced or formed by or in, pathogenic. Gram, recording. Graph, instrument, cardiograph. Graphy, process of recording. Cardiography. Asis, condition or state usually unhealthy, lithiasis. Here graph means cardiograph, graphy means cardiography. It is graph means it is a cardiograph, graphy means it is a process of recording, cardiography. Iasis, condition or state usually unhealthy, lithiasis. Iatry, treatment, medical specialty, psychiatry. Itis, inflammation. Megaly, enlargement, cardiomegaly. Meter, it is a measurement instrument, thermometer. Metry, process of measuring, audiometry. Oid, resembling, fibroid. Ole, small minute cystole, oma, tumor, lymphoma, oocyst denotes a condition. It is abnormal. Which is abnormal? Cirrhosis, pathy, disease, osteopathy, penia, deficiency, osteopenia, pexy, fixation, mastopexy, phage, eating or swallowing, lipophage, phagia is also eating or swallowing, lipophagia, phagic, related to eating or swallowing, cytophagic, these three, phage, phagia, phagic means eating or swallowing only, understand? See this table, once read the suffix, how it is pronounced, meaning and example. This table is very important because all the medical terminology comes from this table only. See, continuation from last side, phagy, eating or swallowing, cytophagy, phasia, speech, philia, affinity, philic, affinity, hemophilic, plasia, formation or growth, hyperplasia, plastic, pertaining to formation, rhinoplastic, plasty, it is a procedure, surgical repair, rhinoplasty, plegia, paralysis or palsy, paraplegia, pnea, breathing, apnea, poiesis, producing, hemopoiesis, rage, excessive discharge, hemorrhage, rhasia, excessive discharge, menorrhagia, raphe, rhea, rhexis, scope, scopy, stomy, tomy, trypsy, trophic, trophy, eula, eul, See the suffixes here, the pronunciation is there. See first pronunciation so that you can pronounce easily, and see the meaning and see the examples. Here medical terms often used as suffixes. Term, pronounced, meaning, example. Centesis, surgical puncture to remove fluid, amniocentesis. Coccus, berry-shaped bacterium, pneumococcus. Constriction, narrowing, vasoconstriction. Cytosis, abnormal increase in number of cells, phagocytosis. Dilation, widening. Ectasia, dilation. Edema, swelling. Emesis, vomiting. Fusion, pouring. See term, meaning and example. Look for pronunciation also. Okay, you can clearly understand how the word will be pronounced. See the irregular plural forms which are singular, bursa, thorax, lumen, cortex, diagnosis, varix, carcinoma, pharynx, spermatozoon, ileum, streptococcus, surgery. These are singular forms ending with a, ax, en, ex, is, x, ma, nx, on, us and y. Now plural ones are bursae, ends with ae, thoraces, ends with aces, lumina, ends with ina, cortices, ends with ices, diagnosis, ends with es, varices, ends with ices, carcinomata, mata, pharynges, nges, spermatozoa, ends with a, ilia, ends with a, streptococci, ends with I, surgeries, ends with IES. Here, once notice what are singular ones and what are plural ones. Let us discuss about the abbreviations. Here, left side abbreviation and right side meaning. Small cc, courtesy copy. Capital CC, chief complaint. Capital DD, date dictated. Capital DT, date transcribed. FH, family history. HPI, history of present illness. IS, information system. MR, medical record number. O, objective. OP, operation, operative procedure, outpatient. OR, operating room, operative report. PE, physical examination. PMH, past medical history. PSH, past surgical history. RO, rule out. ROS, review of systems. S, subjective. SH, social history. TOC, table of contents. The medical terms cannot be written as lengthy forms. So many sheets are written as these abbreviations only. Many medical sheets are written as these abbreviations, and all will call with abbreviations only. They won't call with entire word. For example, chief complaint means they won't write whole spelling chief complaint. They will write only capital CC. In all medical records, these abbreviations are only used. So for seeing abbreviation, you have to analyze your meaning. So once go through these abbreviations and meanings. I think we had discussed a lot about today's topic, బాడీ స్ట్రక్చర్స్ అండ్ మెడికల్ టెర్మినాలజీస్. ఈరోజు బాడీ స్ట్రక్చర్స్ మెడికల్ టెర్మినాలజీస్ గురించి చాలా ఇన్ డీటెయిల్గా డెప్త్గా తెలుసుకున్నామండి. నాకు తెలిసి ప్రతి ఒక్క కాన్సెప్ట్ మీకు బాగా అర్థమైందని అనుకుంటున్నాను. ఏదైనా డౌట్స్ ఉంటే స్లైడ్స్ కొంచెం బ్యాక్వర్డ్ చేసి ఫార్వర్డ్ చేసి చూసుకోండి. మెయిన్ టర్మ్స్ అని చెప్పానండి, కాస్త నోట్ చేసుకోండి. మెడికల్ కోడింగ్ ట్రైనింగ్ కోసం మా ఇండియన్ హెల్త్ కేర్ బీపీఓని కాంటాక్ట్ అవ్వండి. స్క్రీన్ పై నెంబర్ ఇస్తున్న వాట్సాప్ నెంబర్ 7200035525. మెడికల్ కోడింగ్ ట్రైనింగ్ అండ్ సిపిసి సర్టిఫికేషన్ కోసం ఇండియన్ హెల్త్ కేర్ బీపీఓని కాంటాక్ట్ అవ్వండి. వర్క్ ఫ్రమ్ హోమ్ ఆప్షన్స్ ఉంటుందండి సిపిసి సర్టిఫైడ్ కోడర్స్కి. మెడికల్ కోడింగ్ ట్రైనింగ్ విత్ అష్యూర్ ప్లేస్మెంట్ ఫర్ ఫ్రెషర్ అండి. బోత్ లైఫ్ సైన్స్ అండ్ నాన్ లైఫ్ సైన్స్ గ్రాడ్యుయేట్స్ ఆల్సో ఎలిజిబుల్ అండి. హెచ్ఆర్ నెంబర్కి కాంటాక్ట్ అవ్వండి. మీ లైఫ్ని మెడికల్ కోడర్గా స్టార్ట్ చేసుకోండి. థ్యాంక్ యూ అండి. హ్యావ్ ఎ నైస్ డే.